Elk Grove, Park City, Pasadena, one of my colleagues. Hi, Sharon. Great to have you here. Okay, well, hello everyone and welcome to today's joint CASA CWEA webinar. This is our 4th update. And now a word from our sponsor. Oh, there we go. I'm having difficulty advancing, Monica.
Try now. There we go.
Oh, there we go. Sorry.
Thank you so much, Wendy. Please help me to thank today's sponsor. GT Molecular was created to develop molecular detection technology for cancer research and harmful pathogen detection. They have focused these powerful tools on the detection of SARS-CoV-2 in wastewater. Contact GT Molecular for COVID-19 testing for your facility. Results, graphing, and data available in 1 to 3 days for $295 per sample. Visit gtmolecular.com. The first 5 customers who mention CWEA will receive a free test.
Thanks, Monica. I'm Wendy Wirt, president of the California Water Environment Association and the civil engineer with the Los Angeles County Sanitation Districts. I've said it before and I'll start it again. First off, I hope everyone is well, your families are well, your friends are all well and safe. And from CWEA's leadership, I want to give you our appreciation for the work that you're doing. I know these are challenging times in work, outside of work, and you're truly appreciated, especially those of you shown in this slide who are serving day in and day out to help all of us continue providing essential services. Thank you. As a consequence of your actions, we are able sorry about that. I'm having a little bit of Zoom issues. So thank you all for bearing with me. So as a consequence of that, our wastewater facilities continue to serve 5.6 million people and in full compliance, and our solid waste facilities continue to manage trash from about a quarter of our county. It's critical work, it's important work, and with all that you're doing with, our profession has truly risen to the challenge. So what are these challenges? Well, they're unending right now for all of us, but the National Academy of Sciences and Engineering and Medicine listed 5 grand challenges that are interconnected for the 21st century. And they were drafted before the pandemic, yet they're relevant. Today, you're going to hear from experts who are helping to create healthy cities and studies that are helping to foster informed decisions. I would posture that the National Academies of Sciences and Engineering missed one of those challenges that CWEA, you, and CASA are helping with. The biggest challenge for the 21st century is to give all of us, environmental professionals, the tools to address a new future. So what are those tools? What is it that we do need in order to address our new future? Well, first of all, we needed guidelines to help us stay safe. And still, and these are constantly evolving and they're fantastic, but they continue to be affected. Every one of us has been affected. Our first case occurred on March the 27th. Our numbers are low, but since then we've had 75 employees test positive at 17 work sites. So what we want to do is we want to all do our part. And what can we do to help? Well, here you see, for those of you who recognize this, our profession began wastewater monitoring for viruses very early. This is nothing new for us. So in 1979, we started and we've been collecting, concentrating, and analyzing ever since. 41 years later, There we go. So now, 41 years later, we're researching a new virus. I'll brief you on the work that we're doing studying this and some of the most recent data. And then I'm going to provide an update on two sort of breaking news on some new studies that we're involved in. So we're all doing our part. In early March, we launched a plan to develop a method. And our lab has been tremendous. They've come up with an innovative method for analyzing for the virus in our effluent. And our method is a little different than typical methods. Typical methods take the sample and then they concentrate it, and then they're extracting the RNA. What we do is we extract that genetic material before concentrating it. Hopefully this is improving the accuracy. And here you see Rebecca Lopez taking a grab sample, and also one of our microbiologists, Belle Lynch. So what is our objective? Well, the objective is, of course, to provide information and to help track the virus and see if it can be used to indicate the extent of this epidemic. Between these two treatment plants, we are testing effectively 3.5 million people, and in places without sufficient access to testing, measuring for the prevalence in the virus of the virus in the sewage could be a useful tool. So yet another tool, as we talked about this toolkit that we're developing, and we're collaborating with LA County Public Health to see if our data could be used to benefit them, their knowledge, and the fight against the virus. So what we recognize is that working together, we're able to do even more. And I've shown this before, there is so much research going on. It's wonderful. It's an invigorating time. If there's any type of silver lining, it's the collaborative studies that we're all engaged with. And this shows our ongoing efforts, but we're also working, and the point of all of that, the goal being to share these techniques and to share with other wastewater treatment agencies across the country and around the world. And starting this week, this is this breaking news that I talked to you about. Starting this week, I'm pleased to announce that we're participating in a statewide study, and this is with the California Department of Public Health and the State Water Resources Control Board. And this statewide wastewater-based epidemiology program is going to help us to monitor for the virus in untreated wastewater. And what they're doing then, and the reason I'm showing this flow chart here, is we're going to collaborate with the CDC and have that data available once again to contribute and improve our public health decision-making processes. And then I'll close with our last update on December 9th. So this is just last week. On Wednesday, we were informed that our Joint Water Pollution Control Plan has been accepted into phase 1 of a national study. And this is headed up by the U.S. Department of Health and Human Services. This is the parent agency for the CDC, and Aquavitas plans. Now, this is still in the works. We're still working out our monitoring and our sampling plan, but this is something that we're really excited about. And the takeaway from this slide is that the first phase is going to sample, it's a national study, 10% of the population, with an optional second phase that would target about 30% of the population. So I just wanted to close with, let me go ahead and see if I can go back. Can I go back? Well, our data is available on our website. We kind of breezed through that. But if you have additional questions, please do contact our program leads. All of this contact information will be available in our program. And I will give you a moment to read CWEA's standard disclosure. With that, it is my pleasure to introduce today's moderator. Greg Kester is the Director of Renewable Resource Programs for CASA and the Coordinator for Wastewater Issues and Emerging Concerns at the local, state, and federal level. Greg?
Thank you very much, Wendy, and welcome everyone. It's great to see many of you who have been returning attendees, and welcome those who are joining us for the first time. It's unfortunate the pandemic seems to have taken a negative turn for us, So we hope that you are staying safe and um, observing all the protocols. And again, we think the wastewater-based epidemiology can be a real asset and help to our local health agencies as they assess local policies. With that, just a couple of housekeeping items. The chat function, as you can see on your screen, is one that we're only really using today for administrative purposes. If there is an issue that you need to communicate to us, you can do that in the chat, or to converse with your colleagues is fine to use it. But we will mainly be using the Q&A for our questions. So any questions that you have that you want to address to any of our panelists, please do it in the Q&A section here. And speakers will type in answers as they are able to as we go through the panel. And then, of course, we'll have a full Q&A session after all the panelists have spoken. The raise hand function we won't use today. Uh, it's a double-edged sword, I guess. There are too many attendees, though, for us to really effectively use that. So please just keep that in mind. And with that, I think we are ready for our first poll question. And this relates to who you represent. And Monica, if we could see the questions. So the question is, what type of organization do you work for, with numerous options to select from? Large municipality, meaning over 400,000 customers, a medium, which is between 50 and 400,000, small, which is less than 50,000, or a consulting firm, a manufacturer or sales representative, a regulator at the state or federal level. And if none of these fit you, you can select other, and then please do use the chat function for that to explain who you do work for. Okay, maybe we could see the responses, Monica. The largest percentage work for large municipalities. And next comes the mediums, and then the smalls, and then a lesser amount for the other um, options. So thank you very much. And now it's my pleasure to begin introducing our panelists. And I really have to thank all of them again. It's just been a tremendous acceptance of the importance of these webinars. And we really appreciate all the panelists lending their expertise. And to that end, we'd like to first welcome Karen Mogus. Karen is the Deputy Director for the State Water Board's Division of Water Quality, responsible for statewide water quality planning, policy development, implementation, and permitting. Ms. Mogus also served as the Assistant Deputy Director for Drinking Water, directing development of regulations for potable reuse of recycled water, addressing drinking water quality issues in disadvantaged communities, and leading review of the Environmental Lab Accreditation Program. She also served as Director of the Office of Information Management and Analysis, and spent 10 years as the Central Valley Regional Water Board, working on water quality control and assessment programs. And with that, it's a great pleasure to welcome Karen.
Thank you very much. And thank you for inviting me to join the panel today and give an update on our activities at the statewide level. I don't need to introduce myself. Greg just did a great job of that. So I will just hopefully move to the next slide. Let's see if I can get it to work. There we go. So I'm going to provide a general overview of the State Water Board activities in collaboration with California Department of Public Health and give a status update on the phase 1 wastewater-based epidemiology program that we're attempting to develop. Also talk a little bit about other public health use cases for wastewater-based epidemiology, as well as other activities that we are working on and some take-home messages from our update. So we've been coordinating with CDPH since April. We have regular meetings between Cali PA and Health and Human Services on a regular basis, and presented some of the wastewater-based epidemiology work that had been going on at Stanford back in April, and that initiated CDPH's interest and engagement in the project. Our role being the State Water Board, has been to act as a liaison between CDPH and the utilities and laboratories, as well as working on developing data flows to get data from utilities and laboratories up to CDPH and then ultimately CDC. We've also worked on developing protocols for sampling and analysis that are standardized, that are made available on our website. CDPH has received a small grant from the Centers for Disease Control. California was one among 8 states that received funding sort of at the end of the budget year last year. We do anticipate that the funding will continue into the next fiscal year, but details on that have yet to be released. The grant supports a staff epidemiologist that will be coming on board shortly. I believe they've made an offer, and the staff epidemiologist may be starting this week or next week. I'm not positive about that. I have yet to meet her. As well as a data scientist for the program to help us not only with the data flows, but also presenting the data and making it available to the public. However, the grant did not provide enough to support sampling and analysis, which will be clear when I get to the phased approach for our program. We are taking a phased approach to the statewide program that relies on voluntary monitoring from utilities, and just wanted to take this time to thank you all for those of you who are voluntarily monitoring for SARS-CoV-2 in your wastewater influent. It is really commendable how much time and effort you all have been putting into this to help with response to the pandemic. And we hope that the pilot will demonstrate the utility of this monitoring moving forward and spark interest in funding support for a statewide program moving into the future. We anticipate that this, like previous outbreaks of infectious diseases, these tools have been very helpful. And having more of a proactive rather than reactive approach will be helpful moving forward. So now I'm going to give a quick status update of the phase 1 of the wastewater-based epidemiology program that we have initiated. We're working with among the 5 largest wastewater utilities that collectively serve about 40% of the state's population, to voluntarily monitor for the pilot program. These 5 facilities were selected because they had been already participating in a project that was designed for pathogen monitoring in the interest of supporting regulations for direct potable reuse. And so we augmented that project to include SARS-CoV-2 in the analysis, and we're able to use those funds to also develop some standard operating procedures and quality assurance program plan templates for the monitoring. So the 5 facilities are the San Francisco PUC, LA County Sanitation District. Thank you, Wendy, for your participation. She did mention that earlier, as well as LA City, and the Hyperion Reclamation Plant in particular, Orange County Sanitation District, and the City of San Diego Public Utilities Department. So we requested that the utilities monitor for SARS-CoV-2 once a week through the end of December as a test run, and then increase the sampling to 3 times per week starting in January 2021, extending that increased monitoring for a 6-month period through June of 2021. And I say that we requested the utilities to increase their monitoring because we don't have authority to require this type of monitoring, and feel that a more collaborative voluntary approach is best with this particular project. So we sent the request earlier this month and have confirmation that most of the facilities are willing to participate. In fact, all of the facilities are participating at some level, but some have different challenges based on what laboratories they've been using to do the monitoring to date, as well as funding constraints. So we're trying to work through those issues, but have gotten really excellent response to our request for voluntary participation. So the plan is that we will be receiving the data, the State Water Board will receive the data from the utilities and the laboratories, review that for data quality objectives and minimum data standards, and then send that data to CDPH, who will enter it into the national database on an ongoing basis. Make sure I'm on the right. Okay. So, oh, did I skip a slide? I think I skipped a slide by clicking. Sorry. Okay, my apologies. I'm used to sharing my screen, so we're all learning this new remote work and remote activities. So other public health use cases that we've identified as part of the phased approach include targeted sewer shed monitoring to inform SARS-CoV-2 at state prisons, state hospitals, skilled nursing facilities, as well as universities. You may have heard that, I believe it was UCLA possibly had done some testing at the effluent from particular dormitories, and we were able to locate a dormitory that had some cases that had not presented for testing, and so we're able to isolate those and decrease the spread of the virus on the university campus. However, we lack funding and staff resources, as I think most of you all as well. And that is the most significant impediment to developing a more robust statewide program. You might imagine as we get increases in the virus in our influent, the desire, of course, is to go upstream and find out where that's coming from so that we can improve our local response. And that obviously is a much broader, more expensive, more difficult effort than influent sampling. I'm toggling between two things here. So some of our other activities are that we are focused on providing data to CDPH to address their high priority data needs to inform public health decisions. We've met with all 5 of the facilities that are going to be increasing their sampling, and have included the local public health officers in those conversations so that we're collecting data that is most useful to the response efforts at the public health level. CDPH has prioritized the need for the phase 1 pilot monitoring data and has yet to identify specific need for other data, although they are working on some pilot monitoring at some prisons and state health facilities as a starting point for going sort of up the sewer shed. The water boards support open data, as having these data publicly available may advance research in the field. And we've also engaged with the Water Quality Monitoring Council, which is a multi-stakeholder, multi-agency council that is focused on coordinating water quality monitoring across the state. And they have expressed interest in helping to coordinate and compile data from all of the monitoring and research efforts that are going on. So I've mentioned the 5 facilities. There are upwards of 30 to 40 facilities that are conducting this type of analysis across the state, and we just don't have the resources to coordinate everything from academic research as well as small projects going on across the state. And so we are engaging with the Water Quality Monitoring Council to help us with that coordination effort. The State Water Board also is engaging in a peer-to-peer network with other states that are conducting this type of monitoring so that we can share lessons learned and inform California's developing program. And CDPH staff are participating in similar efforts with public health practitioners and academics across the country. So take-home messages, collaboration and information sharing like we're doing today are key to advancing the science and to the success of the monitoring program, both in the current pandemic and then in future responses to potentially future outbreaks. Short-term use of an adaptive management approach to generate the data for CDPH and the CDC can be used to improve public health decision making, and we're hoping that the pilot that we're doing in California will advance this effort and show that this type of program is needed moving forward so that we can be, again, more proactive than reactive moving forward. I already mentioned that lack of funding, it's no big surprise, and personnel resources are the most significant impediment to getting a statewide program and coordinating it. And we want to use these lessons learned from this pandemic and our pilot program to create a handbook that outlines a plan and protocols for future outbreaks. So we're hoping that we'll learn from this current pandemic and be able to be ready for the next virus that comes down the pipe in the future. Let's hope that it's not as impactful as this one has been. And that leads us to our next poll question.
Thank you so much, Karen. Great presentation. And folks, just as a reminder, please type in your questions for Karen in the Q&A section, and we'll address those at the end of the panel. Yeah, so the next poll question is gauging your participation in regular wastewater-based epidemiology monitoring. This is a two-part question. The first is whether you are participating in any regular monitoring of influent and or primary sludge for SARS-CoV-2. Yes, no, and I don't work for an agency. And then if the answer is yes, at what frequency are you monitoring? Once, twice, or 3 times a week, or other? And if it is a different frequency, if you could type that in the chat, would be great. Thank you so much. So it looks like 48% are doing regular monitoring, with also a good percentage who don't work for an agency. Wow, and the most common frequency is listed in the chat, so we'll have to go there to extract that. With a number of folks doing once a week and a lesser amount doing 2 or 3 times a week. So again, thank you so much. And we'll take a look in the chat for the other frequencies. With that though, I'd like to introduce our next speaker, Newsha Ghaeli, who is president and co-founder of Biobot Analytics, the first company in the world commercializing wastewater epidemiology. Prior to founding Biobot, Ghaeli was a researcher at the MIT Sensible Cities Lab and an instructor in the MIT Director of Urban Studies and Planning. Trained as an architect, she has worked with the World Economic Forum's Council on the Future of Cities, the UN Climate Change Summit, the U.S. Department of Energy, and U.S. territorial governments on the design of coastal resilient communities. Ghaeli holds undergraduate and graduate degrees in engineering from the University of Waterloo and McGill University. And with that, it's my pleasure to welcome Newsha.
Thank you, Greg. Thank you so much to CASA and CWEA. Thank you, everybody, for joining today, this morning on the West Coast, and this afternoon on the East Coast, where I am. As Greg mentioned, I am the president and co-founder of Biobot Analytics. I was just able to change my screen. Let's see. Is that working? Trying to remotely control the screen here.
Did you click in the middle there, Newsha?
Yep.
If necessary, I can definitely change your slides for you. Looks like it was working, but let's just go ahead and have me do. Oh,
there we go.
There you go. Okay.
So yes, as Greg mentioned, I'm president and co-founder of Biobot Analytics. Biobot is a wastewater epidemiology company. So we look at sewage as being a medical grade sample, and a medical grade sample. And our mission, our vision at Biobot is to make data from sewage a normalized input into public health decision making, and really leverage data from wastewater to make community health more proactive and more equitable. Our work at Biobot is based on research that my co-founder and I were a part of at MIT for about 4 years, starting in 2013. And we left MIT to form the company in 2017 in order to be able to bring this technology to communities and actually work directly with municipalities. Next slide, please.
So you would like me to change them? Okay.
Yes.
Okay.
Yes, it's not working
no
for
problem.
me. I'm sorry.
Okay, no problem.
So when we first started Biobot in 2017, we focused on what was the biggest public health crisis, really up until 10, 11 months ago, and that was the opioid epidemic. So we started by actually measuring about 30 different opioid and opioid-related drugs in sewage based on what's excreted in urine, in order to be able to really shift from looking at overdose deaths as being the metric by which we evaluate the opioid epidemic in a community, to understanding what types of drugs are being consumed by individuals who are still alive today and can benefit from our public health resources. And so with this work, we were working directly with public health agencies on the most part to actually measure the concentration of these 30 different opioid metabolites in wastewater. Next slide, please. Oh, it looks like I have control back. Thank you, Monica. So this is just a sample of a map that we've generated for one of the communities we worked with. It's an anonymized map of one of the communities we worked with back in 2018 through to the start of the COVID pandemic, where we actually would divide up the city into smaller catchment areas. So we were collecting samples from the manhole level. And we were looking at the different types of drugs, so prescription opioids, fentanyl, heroin, and treatment therapies like methadone, Suboxone, as well as Narcan, the overdose reversal drug, in these discrete regions, so that the city decision makers, the mayor's office, and the public health agency could prioritize communities based on the types of interventions that they were launching. Obviously, needle exchange units or needle drop-off units don't necessarily apply to neighborhoods where we had a high consumption of prescription opioids. And so looking at this data at that geographic resolution helped sort of make these more granular decisions. We were also able to map this data alongside demographic information that's publicly available via census data in order to really paint an entire picture for the public health agencies that we were working with. So everything sort of changed for us as a company, as well as for the world at the beginning of 2020. We pivoted really our focus in February of this past year to focus on COVID-19. It was around that time that researchers discovered that SARS-CoV-2 was shed in the stool of infected patients. So that was about February of this past year. And we quickly partnered up with some of our research collaborators at MIT and the Harvard School of Public Health in order to develop the methodologies, both in the lab as well as data analysis methods, to be able to not only measure the virus in wastewater, but also quantify the amount of virus to understand what the concentration levels are. And by May of 2020, we were working with 150 communities across the US measuring SARS-CoV-2. So in January, we went from working with 7 communities in January measuring for opioids to 150 in May for COVID-19. And I think this also really underscores a little bit the attention that wastewater epidemiology has had in this past year, and how right now we're really, the entire technology, the entire industry is really having a moment to really get off the ground. So over the course of the pandemic, we have worked with about 500 sampling locations, so 500 communities across the US. I say sampling locations because this includes both wastewater treatment plants as well as in some communities where we are sampling in a more granular fashion, so pulling wastewater from manholes. To date, as a company, we've actually analyzed close to about 5,000 samples for SARS-CoV-2. And what I find really interesting actually about looking at the communities we've worked with is the distribution between this, the distribution of the sizes of communities that are participating in this work. Now, just bear in mind, these are just the communities that we've worked with, not entirely all of the communities that are doing this work. But what we've seen is that this isn't just a solution that's of interest to very large metropolitan regions, that actually there's a lot of value in this data for smaller cities, small towns, rural areas, and especially this data becomes very impactful when we are working in regions where there is limited access to testing and some other types of resources. So it's been really great to see communities of all sizes really step up and participate in wastewater-based epidemiology work. Where we see the value of wastewater epi and sort of where we as a company are really framing our value add is around the data insights and the data analysis. So first of all, it was established this summer by a paper that we published, but also it's been corroborated by other researchers in the field that wastewater data is an early indicator for new clinical cases. And we've seen fairly consistently that wastewater data is foreshadowing new clinical cases across many different sizes of communities. There is a scientific preprint as well as a blog post linked on our website that kind of get into the details around some of this analysis that we've done, as well as some other sources published by some other academic groups kind of digging into this. Another thing that our team is working on is a model that can help us estimate COVID-19 incidence in a community. So based on analysis that we've done across these hundreds of locations that we've worked with and looking at their clinical data set alongside the wastewater data, we're able to predict, we're estimating the number of new cases that will be reported in a community in the coming weeks. And then finally, just given the broad scope of sort of geographical representation, We're also contextualizing a community's wastewater concentration as compared to all of the other communities that we're working with. So where do they rank? And what are their neighboring communities or states? What's happening in these neighboring regions? So I wanted to just show briefly this screenshot of several different cities that we worked with over the summer. Again, this is linked on our website to this blog post where we're starting to look at, in blue, the wastewater concentration compared to in red, the new clinical cases reported in that community. And you can see here consistently, again, wastewater data is foreshadowing these clinical cases. One thing that I want to add is this data represents communities as small as 50,000 people in population, or catchment areas as small as 50,000 people, all the way up to catchment areas as large as 1 million individuals. So we see that data kind of hold true across different sizes of communities. I also wanted to show one example of how this data is being used in context. So this is a plot from the website of the Massachusetts Water Resource Authority. This is data that we've been generating for them from the start of the pandemic. So from early March all the way through to, I think I took this screenshot last week. And they've been publishing this data online. It represents about 2 million individuals who live in the greater Boston area. And this information has been picked up by the Cambridge Public School System, where they've put up a dashboard that follows 3 metrics. Those metrics being daily new cases, test positivity rate, and wastewater monitoring, so the virus concentration. And then together with collaborators at the Harvard School of Public Health, they've set thresholds for each of these 3 metrics. And if 2 of them surpass the threshold that they've set, all schooling goes to fully remote as opposed to partially in person. And actually last week this happened, and the Cambridge Public School System's superintendent announced that schools were going to move fully remote for the time being because 2 of the metrics, including the wastewater monitoring, had surpassed the threshold. So this is one example here of this wastewater information in practice and how it's being put to use by a community that we're working with. Now, beyond COVID-19, beyond opioids, we can begin to build hundreds of applications with a wastewater epidemiology platform. We can look at influenza. In fact, our team is already working with a subset of the communities that we're working with in generating data on influenza virus, both A and B strain. And from there, we can really start to look at anything that we are excreting as humans in urine and stool. Also, I want to add that the value of wastewater epidemiology is also changing as we enter into this post-vaccine pandemic moment. Now with the vaccine coming out in our communities, wastewater testing is going to be extremely important to help improve our understanding of vaccine effectiveness. So we will be able to understand the scale at which the virus is still circulating in communities and start to understand the role that vaccine uptake is having on community transmission. And we can also improve our understanding of the duration of vaccine-induced immunity. So monitoring wastewater will help us stay on top of, any flare-ups that may happen once we have kind of a majority of the population that is vaccinated. And so because of all of these reasons, we really believe that wastewater epidemiology should become a permanent pillar of pandemic preparedness across the country. I think if one of the really good things that hopefully will come of 2020 and this year that we've had is a renewed interest and investment, a renewed investment in our public health infrastructures. And we really hope that wastewater epidemiology will be one of these investments that'll be made. And so it's really great and very exciting to hear about all the work that the state's doing, as well as obviously the work that the CDC and HHS are really driving. And with that, I'm just going to close briefly by just giving a little bit of a glimpse into our team composition. Wastewater epidemiology by nature is an extremely interdisciplinary endeavor. We have biologists, data scientists, chemists working with urban planners and engineers and public health scientists on our team. And I think it really reflects the interdisciplinary nature of the other side of the table, on the side of government and agencies that really need to come together to make use of this information. We have the sanitation industry really coming together with public health and our policymakers and executive offices to really be able to best leverage this data. And with that, I am going to say thank you and pass the mic over to Greg. Thank you so much.
Thank you so much, Newsha. Great job. And with that, we have one more polling question before our next speaker. This is on the type of lab which is conducting analyses. If we can see it, Monica. And it's simply that, what type of lab is conducting your analyses if you are doing wastewater surveillance testing, whether it's in-house, your own lab, whether it's a university or public lab, whether it's a private or commercial lab, and if not applicable, if your organization is not doing the analyses, or other. And if it's other, please list that in the chat. And just as a reminder to continue to place your questions in the Q&A section for the speakers. And can we see results, Monica? About equally split between in-house, university public, and private commercial of those who are doing it. So thank you all very much. And with that, it's my pleasure to introduce our next speaker, Nancy Stetson. Nancy is a city data analyst for the city of Burlington, Vermont, and a core member of the city analytics team, which was formed to provide research and advice on best practices in response to the COVID-19 pandemic. She leads the COVID wastewater project, which provides an early warning for coronavirus outbreaks in the community. She holds a master in public policy from the University of California, Berkeley, and was previously the data analyst for the Burlington Police Department. And with that, it's my pleasure to introduce Nancy Stetson.
Hi, everyone. I'm going to try to get control of the screen. Let's see. There we go. All right, so I am here to talk a bit about what we're doing in Vermont around wastewater-based epidemiology. So I'll give a little background about the state where we are in the COVID pandemic and how we sort of got to wastewater-based epidemiology. And then I'll talk through how we designed the program, how it's being used day to day. And then finally, I think the most key part is how we're actually putting the results to use. So first of all, a little background on Vermont. I do want to say, first off, Vermont is tiny compared to California. The entirety of Vermont is about the size of Sacramento or Oakland. So it's on a much smaller scale than I think a lot of people here are working with. And then our program is based in Burlington, and Burlington itself is about 40,000 people. So it's a pretty small area. And we have been really lucky during this pandemic. We've missed the worst of it, or it's missed us. Vermont has the fewest cases per capita of COVID-19 than any other state. I think the flip side of that is that we have the most susceptible people of any other state because it hasn't gotten to us yet. And so there is concern about a bigger wave here that could come. So this chart just shows a comparison between the cases in California versus Vermont. And as you can see, Vermont had very few cases over the summer. We were averaging maybe like 5-10 cases statewide for the whole summer, but that's ticked up recently. And in the past few days, we've had about 100 cases a day, which may not sound a lot in California numbers, but it's concerning. And everyone has to stay inside basically all winter in Vermont. So there is concern about what's going to happen next year. So the idea for wastewater-based epidemiology came around largely in response to the college students coming back to campus. So like I said, Vermont had very few cases early on, but about a quarter of Burlington residents are college students. And there was a real concern in the community that even though we had low cases in the summer, the college students would bring cases to the city. So we set up the wastewater monitoring program initially as a pilot project, I think just testing, maybe once a week. And it actually just showed throughout the early fall that there weren't outbreaks. And that was actually really useful information to have, to know that the colleges weren't causing a surge that was going undetected. I will say since then, we've sort of shifted our thinking around what this type of project should be for. The college students were actually being tested every week in both of the main colleges in town. And we think now that wastewater-based epidemiology actually has a lot of use for catching people who wouldn't necessarily be tested, either who are unwilling or just don't have access to testing, and it provides sort of a blanket test to the whole city. So in September, we decided to continue with the project, and we decided to work with GoAgua going forward. We worked with GoAgua to design the program. I will say the caveat, I was not deeply involved in this process. A colleague of mine mostly helped with this part, but I will tell you about it. So the project itself is a collaboration between my department, which is the Department of Innovation and Technology at the city, our Department of Public Works, and it's also closely, we collaborate closely with the Vermont Department of Health. The city itself does not have a Department of Health, it's just statewide, it's just one department. We use GoAgua for analytics, and then GT Molecular Lab runs the actual samples. So the plan itself integrated hydraulics, the prevalence of COVID in the city, and then the vulnerability of the population. It took into account a lot of things. A big part of it was splitting up the city into 5 sub-sewer sheds of approximately equal population of like the same sort of residential density. And then the results themselves go to GoAgua's dashboard, which you can see all of these factors on the dashboard. One thing that's been really useful for us is it lists all the hospitals and particularly the nursing homes in any given sewer shed. We have had problems with nursing home outbreaks here in Vermont, and it has been a big part of the wastewater program is giving nursing homes early warning if there is an uptick. The other part of the plan that GoAgua helped design and think through is how we shift sampling depending on the prevalence. So early on, the goal of the program was to catch outbreaks early. But at this point, we're now detecting cases in every sewer shed and sub-sewer shed. And so our sampling plan has sort of shifted a bit. And instead of sampling frequently throughout the week, we've pulled back a bit because we know we're going to get cases, and now we want to see if there's any sewer sheds where cases will decrease, or if there's any that are surging. So that's sort of what we're looking for now. So the next step is going to be thinking through how we're actually using the program. So as I said, it's a collaboration between these entities. I think the collaboration with the Department of Health is really important because they add legitimacy to the project. We don't have any epidemiologists on staff, and they've been really interested in the results, and they track them, and they help us decide about how we're going to send out a message about what we're seeing in the results. So we use the web portal to look at the results. The city is broken up into these 3 sewer sheds, and then further broken down into the 5 sub-sewer sheds. They have about equal populations, and this helps us pinpoint where the actual outbreak is happening. I think each sewer shed is somewhere around 10,000, maybe a little less than 10,000 people each. And the dashboard shows like the population levels. That it also points out where the nursing homes are. And then we are also able to download the full results. So we've been tracking the results, and I put together this chart that we use. I'll talk about it a little more later, but it helped cement our messaging around Thanksgiving about asking people to stay home, and then post Thanksgiving, encouraging people to get tested, encouraging people to be careful, because we did see a spike in the wastewater right after Thanksgiving. And then this slide shows a bit of how this increase in cases has come about since the start of the program. So at the beginning, in that first map, you see that we weren't getting detects anywhere in the city, and then it sort of crept higher and higher over the past 6 weeks or so, and is continuing at high levels. So the final section I do want to talk about is how we've actually used the results. And I do think this is the trickiest part of this kind of project, where you can get the results, you can get the samples, and they tell you some things, but it's not always clear cut what the city should do as a next step. So there's a number of different goals for the project, like anticipating outbreaks and putting out public awareness, but you have to sort of know what you're looking at. So this matrix just shows the level of risk based on how high the virus actually is versus whether it's growing or not. And so you can see we do have one sub sewer shed in that red box, and we've been watching that closely over the past week, and it does seem to still be growing. We'll be getting results back soon, hopefully, to test that out. But even knowing that it's high, we have to then take that information and figure out what to do with it. So in the city, we have a couple options, a couple strategies we've used to take the high readings and put them into action. The first is setting up with the Department of Health pop-up tests. So these are just like testing centers that are there for a few days. We put them in the neighborhood where there's been an increase. The other is this sort of general public awareness, talking about the risk, trying to advertise where there's high risk and where people should be careful, where people should think about getting tested. And then finally, we do have some direct communication channels with nursing homes, and then also with marginalized populations. Burlington has a significant refugee population and other new Americans. And so we have been working on ways to communicate directly with them so that they're aware of the risk and know how to get tested too. So for that first strategy with looking at public awareness, one strategy we had that it was my boss's idea, and he loves this idea of putting out these roadside signs that warn people of elevated risk. We put this out in the first neighborhood that had a spike. It got some press coverage, as you can see. I would say, like, going forward, it doesn't have the same impact if it's not new anymore. But it did get people interested in the program and aware that there was a spike. The other picture you see here is our director of the water division. She's been doing media appearances. She went to a neighborhood town hall to talk through about what we're doing with wastewater. The mayor also used a version of this chart I showed before at a press conference directly after Thanksgiving, warning the city that we did see a spike, that there were more cases in the city, and that people should be careful, that people should get tested if they can, especially if they gathered with other people over Thanksgiving. The next step I mentioned is setting up these pop-up tests, which we wouldn't be able to do without working with the Department of Health. That's a key component there. We've been able to split costs with them for this testing, and they're able to help set this up. These testing centers, can be put right in the neighborhoods that we're trying to target. I will say one of the challenging things is often the people we want to go get tested are the people who are least likely to sort of decide to go. There's some people in the population who want to get tested all the time, and some people who just aren't interested. And it's targeting that testing towards the people that we think maybe are going unnoticed. We also, like I mentioned, there's a weekly phone call with nursing homes, and we're able to talk to them directly about the risks. Unfortunately, there was a large outbreak in a nursing home in Burlington, but we've had a couple successes with using the wastewater data, and 2 different nursing homes who took steps after hearing that and actually managed to avoid wide outbreaks because of that. So that we count definitely as a win, even though any amount of cases in a nursing home is tragic. We've also been, like I said, using these trusted community voices to reach out to both new American communities and other marginalized communities to encourage them to get tested. We offer interpretation services at testing centers. We've also reserved some times at testing locations that are advertised solely by word of mouth, because we found that once we post times online, they get filled up very quickly. And again, those low propensity people who aren't interested in testing might not get a spot. So we want to make it as easy as possible for people to get tested. And then the final way we use wastewater results is thinking through how we should be sampling for the next week and going forward. So we'll take our results and we'll think through, what it means for next week and how we should be targeting our samples based on whether we saw high results. So for example, we saw high results in the North plant last week, and we'll be looking at that closely in the coming weeks. All right, and that's it for me. Thanks.
Thank you very much, Nancy. Great job. And I think we have one more poll question here, Monica, and this is a very relevant one. Who is paying for any analysis that you may be doing? So the question is, what types of entities have paid for the analysis of your wastewater samples? And please select all that apply, because you may have multiple sources. But academic institutions through a grant, your own agency or utility, a government program, a philanthropic donation to an analytical lab, or not applicable, you're not doing analyses, or if it is something else, please list that in the chat. Thank you. We'll give a few more seconds here. So it looks like the vast majority are your own agency or utility is paying for the analyses. That's what I feared. In other cases, academic institutions are doing it either through their own benevolence or through a grant. And then there are some with a government program. Excellent. Well, thank you much. And this brings us to our final panelist, who is a team of two, leading off with Christoph Dobson, who is the Director of Policy and Planning for the Sacramento Regional County Sanitation District, known as Regional SAN, and the Sacramento Area Sewer District. Christoph has a Bachelor of Science degree in Civil Engineering from UC Davis and is a registered professional engineer in the state of California. He also holds a Grade 1 certification in collection system maintenance from the California Water Environment Association and served as president of that association in 2014. Christoph has 27 years of experience in the water and wastewater field and previously held the position of Director of Operations for the Sacramento Area Sewer District. And he'll be joined by Dr. Lisa Thompson, who is appointed Chief Scientist for Regional SAN in the Sacramento Area Sewer District in 2014. She leads and supports Regional SAN's efforts regarding compliance with permit-related studies and engagement in Sacramento San Joaquin River Delta research, and serves as a technical resource for scientific research needs for both districts. Previously, she worked for the University of California, Davis as a fisheries specialist in cooperative extension and is director of the Center for Aquatic Biology and Aquaculture. She holds a Bachelor of Science degree in zoology, Master of Science degree in biology, and a doctorate degree in zoology. And it's my pleasure to welcome both Christoph and Lisa.
Still not, okay, let's see. Hopefully this will work soon. Just bear with me.
Christoph, it's Lisa. Is your video enabled?
Yes, my video is enabled and
Okay.
I am, there it goes.
There it goes.
All right. So thank you, Greg, and thanks all of you for joining us today. Lisa and I are going to be tag teaming the slides. So I have the first part and then I'll finish up at the end. And we're just going to be sharing our experience with wastewater-based epidemiology here in Sacramento. So first, just a little bit of background on Regional SAN. We serve about 1.4 million people in the greater Sacramento region, and we have a permitted dry weather capacity of 181 MGD at our plant. And we're right in the middle of a huge upgrade that we call Echo Water. We're adding on, it's about a $1.8 billion capital program to add on two major components. One is biological nutrient removal, and then we're also adding tertiary filtration to our system to enhance disinfection. So as you can imagine, with an operating plant, there's a lot going on at the time, and our lab staff are very busy. So we have chosen to not have them do the analysis of the samples that those are being sent out. They are doing the sampling efforts. Just a little bit on the timeline. We made a decision back in March to begin monitoring for the virus in the influent. We've been doing sampling and analysis since April through June. Then there was a pause there on the analysis, and we were just archiving samples in July. And then August through December, continued sampling and resumed analysis as well. And basically the message here is it's kind of been a patchwork of few different partners, and we had some supply chain issues. And so even though we've been monitoring smoothly throughout, the analysis part has not been continuous, and we've had different parties involved. So our initial decision to participate in WBE was an executive level decision. And the two basic reasons for that, one is that it was a significant investment without a clear outcome yet. We were not quite sure what we would get from all of this. And then also, I think it's been touched on before, but this was potentially a newsworthy thing, so there might be a fair amount of media attention. So normally we would do our studies by a committee would review requests for studies that would come in and make those decisions. But in this case, we brought it to our executive team. So some of the considerations were what's in it for regional sands customers. Obviously, they're the ones that are paying for this, so we want to make sure that they're getting some value out of it. We had the resources, obviously, as a larger agency to take on this responsibility, and referencing back to the poll question, we paid for and are paying for our analysis. So we felt we had this responsibility to take this on regardless of that additional cost. And so that's what we've been doing, just feeling like we didn't want to miss the opportunity to collect this information and have it contribute to fighting the pandemic, and certainly not, come out a year later and look back and say, gosh, maybe we should have done this sampling. So that's has been our approach. And with that, I am going to turn it over to Lisa, and I'll continue with the slides.
Great, thank you. Good morning, everyone. I'm really glad to be with you today. And I just wanted to say too, we contributed quite a few of the poll questions, so it's kind of good. It's kind of primed you for this part of the talk. One of the things we've found as we've been approached to get involved with various monitoring and studies is that there's a lot of different ways that you can go, a lot of ways you can approach it in terms of, are you doing monitoring or research? What kind of lab is going to be doing the analyses? Who's paying for it? And the funding mechanisms, whether you're doing it as a grant, fee-for-service, contract. And there's trade-offs with all of these. Just as an example, who's paying for it, the cost. We've had some work done where the academic institution approached us and we got involved with a research study. In other cases, we're paying to have the work done as a fee-for-service, a contract basis. So we've had monitoring done through the University of Arizona West Lab. We were working with them initially. And then we have been having samples analyzed by Biobot since then. We've also been involved in research studies with Stanford University and with the University of California, Davis. And more recently, a combination where Biobot was working with the Massachusetts Institute of Technology. So we've really gotten to experiment with all of this and gotten to kind of see the pros and cons of doing it different ways. Next slide, please, Christoph. Great. So what have we learned? So what I'm going to do, I've talked to you about the approaches. I'm going to talk to you about what we've learned. I'll talk to you about what we've done with that new knowledge, and then a little bit about where we think we're going in the future. So in terms of what we've learned, first off, and Christoph mentioned our lab staff, I just want to say, truly, our lab and operations staff have been amazing. And they're working under pandemic conditions. They put in extra work to collect these samples. And in the case of the research studies, it can be complicated. They're not maybe just not asking for plain influent. They're saying, oh, we want your influent and we don't want it to have gone through your pre-chlorination step. And we had people off in parts of plumbing of our treatment plant that I don't think had been seen in quite some time trying to get those samples. So there's that complexity. And you'll also find things with the timing of when you get your results back, which I'll get to in a second. So in terms of what we've received back for results, we've had both presence-absence reported, and more recently, we're getting concentrations of the viral material in the influent. For the research studies, we haven't received data yet, but we hear that we're going to be getting some soon. So that kind of ties back to that timeliness issue. If you're wanting to get data to give to your public health authorities right away, maybe the research institution can do it, maybe not. So far, we haven't seen that, but I think they're gearing up more that way. Next slide, please. So moving on to some of our results, these are some of the earlier results that we got through the University of Arizona West Lab. This was that sampling done from April to early June. And most of the influent samples were negative for the SARS-CoV-2 virus. We also did some sampling for secondary influent and for primary influent. And that was mainly so that, assuming that the samples were negative, that we could assure the public that there was no longer any virus detectable in our effluent when we were discharging that. And if you look at the table down below, you can see that for the influent, 2 of the 8 samples collected got a positive hit for at least one of the viral markers, but for our secondary influent and final, it was always undetectable, which was great. Next slide, please. Okay. So we shifted over to Biobot over the summer. The University of Arizona was shifting what they were doing in terms of their lab work. They were no longer doing fee for service, and they were shifting over to analyzing for the college students when they came back to college in the fall. So we set up a contract with Biobot, and we've been getting weekly sampling done. And so far, all tests to date have shown presence of the viral material. And as you can see from the chart below, the viral material is concentration is tracking the new cases. So the graph is showing their data from August to December, and the gray bars are showing the cases reported in our county on a daily basis. And you can see there's a spike once a week, and that's because they don't report on weekends. So we get a higher number of cases on Mondays. The black line is showing the 7-day moving average, and the blue line is showing the normalized SARS-CoV-2 virus concentration. And just a little plug for Biobot, they send us this every time they analyze the samples. I didn't have to lift a finger to show you this graph, which is really nice. I also mentioned that we had been involved in a study with Biobot and MIT. If you look over on the right of the graph in that orange circle, there's daily sampling, and that's sampling that was done between, I believe it was the day before Thanksgiving or Thanksgiving Day, and for 14 days total. And the idea there was they wanted to see if they could detect a spike in cases and spike in virus in the influent related to the Thanksgiving holiday, and whether that would stand out against the already rising trend in cases that we have in California and many parts of the country. So thankfully we didn't see a huge spike, but it was really interesting to be involved in that study. Next slide, please. Great. So how have we used this information? Well, a lot of different ways, and mainly for outreach at this point. We've done outreach to our staff through briefings and also through our monthly newsletter. It's been nice to let them know that we're studying what's going on. They appreciate that. Outreach to our board. Our executive management has given updates to our board about the monitoring and the research studies we're involved in, so they know that we're on it from that point of view. And then outreach to our county public health staff. And this has been interesting. We've been in communication with our county public health officer since the beginning of the pandemic back in February, and we'll continue to coordinate with her and share the results as they come in. I would say, though, that I've heard our county health staff, and I'm pretty sure it's true around the country, are really maxed out. You know, they've been working long days for 10 months, and I think they just don't have a lot of bandwidth. So they're happy to receive the information, but we're not getting a lot of interaction about what to do with it next. And I think it's just not clear to them how they're going to use that information, that leading indicator information, when they're so used to, through their training, looking at cases and using the cases to predict what's going to be happening in the hospitals and what they need to do with public health orders. So, I think there's work going on in terms of figuring out the data needs of public health and how best to communicate with them, and that will be really helpful in the future. Next slide. Great, thank you. So in the future, where are we going to go? Well, a lot of themes that you've heard already today, the joys of going last, but we're going to be continuing our COVID monitoring of our influent. It'll be interesting to see what happens with vaccination programs rolling out, and also possible resurgences if the vaccine produces immunity, but it's waning immunity. And we've recently joined the National Wastewater Surveillance System, and we're joining a project that Stanford has through a Center for Disease Control Foundation grant. This is hot off the press, but they're going to be doing daily sampling of our primary sludge. So they're focusing on the solids phase versus the National Wastewater Surveillance System, I think, is going to be focusing more on regular influent, but we will see. Beyond COVID, as folks have mentioned, it'd be interesting to monitor for future viruses that could cause pandemics. And I think it's going to be really interesting to see if this kind of epidemiology becomes part of the suite of services that wastewater treatment plants can offer to their communities. And I'll hand back to Christoph. Thank you.
All right, thanks, Lisa. I'm going to just touch briefly on some programmatic considerations, and this has been touched on already in a few places, but who should pay for this service? And if you think about it, if you're agency is paying for it, then the ratepayers of that agency are paying. But it's a significantly broader than that. Obviously, it's a public health issue, so perhaps some public health dollars should go towards it. And then really, if you think about it more, it's much more widespread than that. It affects economies and really across our country and even throughout the world. So the thinking from our perspective is that probably lends itself towards more broader revenue sources to do this work than just having it on the backs of the individual agencies. Lisa touched on it a bit, but we have all these different ways to get the analysis done. What's the best way? Our thinking at Regional SAN is to kind of combine the strengths of these different groups to develop something that's optimal. And then one point I would make on that is just to make sure that we develop some consistency on our methods and how we analyze, how we take the samples, et cetera, so that we're able to compare our data. And then just a few parting thoughts. It was interesting as we've been through this, it's been very much an opportunistic situation from the perspective of the different partners that we've had. It's just been really who has contacted us or who we have found. We haven't had a lot of time to dig into, selecting the best partners and analyzing that. We've just jumped in and really had to get the work done. It's been a bit of a feeling like we're jumping on this bandwagon. It sounds really cool to be participating in wastewater-based epidemiology. But the question still remains really, although we see bits and pieces of the work becoming useful and becoming a tool, but it really is still a question in our mind, how are we going to use this information to truly make a difference? And the bottom line there is that what really pushed us forward is just that we didn't have a lot of information, but we felt that we needed to push forward and do the WBE because it is a public service in this emergency situation. And as we all know, in the wastewater business, we're kind of used to dealing with those emergencies and just jumping in and getting the work done. So that's how we approached it. One last thing, it really helps to have some clear strategic direction. Go back to your mission and vision and values. For us, both our mission and vision statements are very supportive of moving forward with a WBE program. And then also in particular, our values. We have 4 core values: responsibility, resolve, proficiency, and environmental stewardship. And in particular, responsibility stood out to us as something that we felt that as an agency that had the resources to do this work that we absolutely should. And so we're having that strategic direction in place really made the decision-making much easier. So that would be my recommendation. And with that, I believe I will be turning it back over to Greg.
Thank you very much, Christoph and Lisa. Great jobs as well. And we can get into the Q&A section now. We're a little bit limited on time, but I think the speakers have been answering questions as we have gone through it as well. But I'd like to start off with one for Karen. And you mentioned the Water Quality Monitoring Council's engagement, and wondering how agencies who are doing wastewater surveillance might share the data with the council. Is that something that should be done, or is that not an area of engagement?
Well, we're hoping that the data from utilities, we can get the data flowing to the state board. And so I'd say, and in order to get it to the council, the state board can do that and make that connection. I think what they're lacking, or what we're lacking, is the connection of the data to the research entities, the academics. And so we're hoping that the council can help us make those connections and get the data flowing. If you are at all interested in getting your data flowing into the system for state board and then ultimately CDPH and CDC, please feel free to contact me, and I can get you in contact with the right people and get you data templates and minimum data standards that are necessary for the CDC database and all of that.
Thank you, Karen. Great. Um, and let's pivot to Newsha. And a question that was posted is whether or not Biobot has an accessible listing of all of your monitoring sites, and can those sites share data and locations?
Mm-hmm. Yeah, thank you. Well, actually, so we don't. Short answer is we don't yet. However, inspired by the COVID-19 Twitter account, Colleen's Twitter account that we all follow at Biobot, we are actually looking into curating a list of the communities that we work with who are already publicly sharing their data. So we don't share the data of the communities we work with. We let them take the lead in that. And so if they're already sharing it, we're actually working to put a list together that we would put on our website and can share more broadly.
Thank you. And the database that you referenced there is the one that Colleen Naughton has at UC Merced?
Yes, exactly. Yeah. So they if you check them out at COVID-19, you'll see on their Twitter feed, they actually put together a map of all of the locations across the world, actually, not even just North America, that are doing this work and the data that's available.
Yes, Colleen was a speaker at an earlier webinar for us, so we have some familiarity. Thank you. And a question really perhaps for Lisa, but others as well. And Lisa, you mentioned that Regional SAN has joined the National Wastewater Surveillance System. And can you just go into a little bit of what that means? Are you able to enter Regional SAN data into that database?
We don't know yet. We saw the letters go out, and I should mention, Greg, I just want to thank you and CASA, your staff, for letting folks in the California wastewater community know about these opportunities, because we found out about this one from you. We've sent in our very basic information about who we are. We got accepted into the program, I want to say last Friday or this Monday, and we've signed an agreement saying that we'll provide various sorts of wastewater samples, but we haven't been contacted about the specific frequency or the specific constituents that we would be providing, whether it's just straight influent, settled solids, primary sludge. It could be any of those from what we saw in the agreement, but we really don't have details yet. I think they're trying to get everybody up and running by mid-December, and I know they needed that agreement in order to send the sampling tubes to our lab. So I'm assuming the tubes are in the mail, and I'm not sure what's going in them. I wish I knew more, but we just don't yet.
Great, and that may have been a misstatement on my part. So what you're talking about is that you have been included in the grant that the Health and Human Services has for testing 10% of the U.S. population.
Correct. So we responded to the Aquavitas request, and we were accepted into the phase 1 of that program.
Great.
That's about as much as we know so far.
Right, and I guess my question was more on the database, and Newsha, you may have some insight on this, or Nancy, as to whether or not you're able to, CDC and Health and Human Services have created a database called the National Wastewater Surveillance System and Decipher, and wondering if you've been able to enter your own results into that database. Or I had heard at one point that only public health agencies could actually enter data.
Mm-hmm.
That's how I thought it was happening.
Yeah, similar. I think that's our understanding as well. I know we as a private entity are ineligible. And then my understanding so far, as of a couple months ago, they may have changed this, but is that the database is only made available to public health agencies. So like a state epidemiologist, for example, rather than utilities and state agencies.
Okay, thank you. And another question, perhaps for Karen, is whether or not the state water boards are also working with the university communities. We have a lot of universities in the state who are doing research on this and doing a lot of work, and wondering if the water boards are engaged with them.
We are in two respects. There's a Bay Area consortium of folks working with UC Berkeley that we are involved with their working group that includes several utilities, I don't recall how many, as well as the local public health folks. They have received funding to develop a dashboard. So we're working with them and just really mostly just sharing information. We aren't directing anything specific, trying to make sure that they do get their data flowing to the state board. And then the second, which is, as I mentioned in my presentation, Stanford University early on contacted us to coordinate, and we've provided them with ancillary data information that comes to our CWEA-CASA data system so that they can use that to analyze their data that they're getting from the 25 facilities they're now working with in the state. We've also connected Stanford up early on with the Southern California Coastal Water Research Project, or SQUIRP, to augment their number of facilities in Southern California. And then also our regional board offices have been working closely with them to add facilities that are, smaller rural facilities that provide more information, at least early on, in areas where there was less cases in the community.
Great. Thank you very much. Great to hear. And one final question for Nancy is, Goagua had been one of our panelists on an earlier webinar as well, but very interested in how your project is funded. Is that, as Christoph said, with Regional SAN, this is something that you're doing out of your own budget?
Yes, I am not 100% of the details, but the first part of that, we're in what we call phase 2 right now with Goagua through December, and that was funded out of a state reimbursement, I believe. So we are going to get paid back for that money, but then going for our pilot project was city money, and going forward to phase 3, I think will be city money also.
Good. Well, thank you all very much. A great panel as always. Much appreciated, and I will turn it back to Wendy.
Oh, thank you so much. This has been so informative. I'd like to join Greg in thanking our speakers for sharing their expertise in today's update. This is our last update of this year. So as it comes to a close, I just would like to express our gratitude for each of you in doing your part in keeping all of us safe and providing essential services. We hope to see you at our next COVID-19 update. That'll be next year on January the 27th, 2021. And until then, we wish you, your families, safe and happy holiday season and a prosperous 2021. Thank you, everyone.
Thank you all.